This program is brought to you by Emory University.
Good morning, and thank you for coming here today. I'm Bruce Rebner, the Medical Director of the Infectious Diseases Unit at Emory University Hospital. I lead the team of doctors, nurses, laboratory technologists, chaplains, and many others who have cared for Dr. Brantley and Mrs. Wright-Boll, two patients who were treated at Emory University Hospital for Ebola virus disease. Today, I'm pleased to announce that Dr. Brantley is being discharged from the hospital. After a rigorous course of treatment and thorough testing, we have determined, in conjunction with the Centers for Disease Control and state health departments, that Dr. Brantley has recovered from the Ebola virus infection and that he can return to his family, to his community, and to his life without public health concerns. The second patient, Mrs. Wright-Boll, was discharged this past Tuesday, August 19th. The medical staff here at Emory is confident that the discharge from the hospital of both of these patients poses no public health threat. The hospital is respecting Mrs. Wright-Boll's wishes for privacy at that time, so we will not be making any further comments about her clinical course. Speaking on behalf of everyone at Emory, we are tremendously pleased with Dr. Brantley and Mrs. Wright-Boll's recovery, and we are profoundly grateful for the opportunity to have applied our training, our care, and our experience to meeting their needs. All of us who have worked with them have been impressed by their courage and determination. Their hope and faith have been an inspiration to all of us. In addition, both of the patients' families provided tremendous support throughout this treatment process. Their dedication and devotion have strengthened us as well as the patients. Limited knowledge of the Ebola virus, especially in our country, has created understandable anxiety and fear for some persons. We understand that there are a lot of questions and concerns regarding Ebola virus and the infection that it causes. However, we cannot let our fears dictate our actions. We must all care. As grateful as we are today, our work is far from over. We are very mindful of all of those in West Africa who are still fighting for their lives against this threat, and those who are caring for them, putting their own lives in danger. It was the right decision to bring these patients back to Emory for treatment. What we learned in caring for them will help advance the world's understanding of how to treat Ebola virus infections and help, hopefully, to improve survival in parts of the world where patients with this infection are treated. At Emory, our mission is to heal and to advance knowledge. The team of professionals with me here today has trained for years to treat and contain the most dangerous infectious diseases in the world. We are grateful for the successful outcome in this case, but we are never going to be taking success for granted. Three other critically important partners who have helped us throughout this episode deserve recognition today. Our neighbors, the Centers for Disease Control, the Food and Drug Administration, and the state epidemiologists of Georgia and North Carolina. I will be taking your questions, as Mr. Dollard said, but before doing so, Dr. Brantley has requested to make a brief statement. And as Mr. Dollard said, Dr. Brantley will not be taking any questions following his statement, so I ask that you respect his wishes and save your questions for me and for the other members of our healthcare team. Thank you.
Dr. Brantley. Today is a miraculous day. I'm thrilled to be alive, to be well, and to be reunited with my family. As a medical missionary, I never imagined myself in this position. When my family and I moved to Liberia last October to begin a 2-year term working with Samaritan's Purse, Ebola was not on the radar. We moved to Liberia because God called us to serve the people of Liberia. In March, when we got word that Ebola was in Guinea and had spread to Liberia, we began preparing for the worst. We did not receive our first Ebola patient until June, but when she arrived, we were ready. During the course of June and July, the number of Ebola patients increased steadily, and our amazing crew at Elwa Hospital took care of each patient with great care and compassion. We also took every precaution to protect ourselves from this dreaded disease by following MSF and WHO guidelines for safety. After taking Amber and our children to the airport to return to the States on Sunday morning, July 20th, I poured myself into my work even more than before, transferring patients to our new, bigger isolation unit, training and orienting new staff, and working with our human resources officer to fill our staffing needs. 3 days later, on Wednesday, July 23rd, I woke up feeling under the weather. And then my life took an unexpected turn as I was diagnosed with Ebola virus disease. As I lay in my bed in Liberia for the following 9 days, getting sicker and weaker each day, I prayed that God would help me be faithful even in my illness. And I prayed that in my life or in my death, that He would be glorified. I did not know then, but have learned since, that there were thousands, maybe even millions of people around the world praying for me throughout that week, and even still today. And I've heard story after story of how this situation has impacted the lives of individuals around the globe, both among my friends and family, and also among complete strangers. I cannot thank you enough for your prayers and your support. But what I can tell you is that I serve a faithful God who answers prayers. Through the care of the Samaritan's Purse and SIM missionary team in Liberia, the use of an experimental drug, and the expertise and resources of the healthcare team at Emory University Hospital, God saved my life. A direct answer to thousands and thousands of prayers. I am incredibly thankful to all of those who were involved in my care from the first day of my illness all the way up to today, the day of my release from Emory. If I tried to thank everyone, I would undoubtedly forget many. But I would be remiss if I did not say thank you to a few. I want to thank Samaritan's Purse, who has taken care of me and my family as though we were their own family. Thank you to the Samaritan's Purse and SIM Liberia community. You cared for me and ministered to me during the most difficult experience of my life, and you did so with the love and mercy of Jesus Christ. Thank you to Emory University Hospital, and especially to the medical staff in the isolation unit. You treated me with expertise, yet with such tenderness and compassion. For the last 3 weeks, you have been my friends and my family. And so many of you have ministered to me not only physically, but also spiritually, which has been an important part of my recovery. I will not forget you and all that you have done for me. And thank you to my family, my friends, my church family, and all who lifted me up in prayer, asking for my healing and recovery. Please do not stop praying for the people of Liberia and West Africa and for a quick end to this Ebola epidemic. My dear friend Nancy Wrightbowl, upon her release from the hospital, wanted me to share her gratitude for all of the prayers on her behalf. As she walked out of her isolation room, all she could say was, "To God be the glory." Nancy and David are now spending some much-needed time together. Thank you for your support throughout this whole ordeal. My family and I will now be going away for a period of time to reconnect, decompress, and to continue to recover physically and emotionally. After I have recovered a little more and regained some of my strength, we will look forward to sharing more of our story. But for now, we need some time together after more than a month apart. We appreciate having the opportunity to spend some time in private before talking to some of you who have expressed an interest in hearing more of our journey. Thank you for granting us that. Again, before we slip out, I want to express my deep and sincere gratitude to Samaritan's Purse, SIM, Emory, and all of the people involved in my treatment and care. Above all, I am forever thankful to God for sparing my life, and I'm glad for any attention my sickness has attracted to the plight of West Africa in the midst of this epidemic. Please continue to pray for Liberia and the people of West Africa, and encourage those in positions of leadership and influence to do everything possible to bring this Ebola outbreak to an end. Thank you.
Okay, I'll send you one. We'll send you a special copy.
The preceding program is copyrighted by Emory University.